But, big but, B-U-T, states cannot do this on their own, okay? Period. This is a massive undertaking. This is a larger operational undertaking, I would argue, than anything we have done during COVID to date. This is a more complicated undertaking and task. And we need the federal government to be a competent partner with this state and with every state. Think about it. 20 million people in the state. Most of the vaccinations they're talking about now require 2 vaccinations, okay? 2 dosages. Depending on which one, 21 to 28 days in between. You would have to organize an effort to vaccinate everyone once, record when they were vaccinated, with what vaccine, bring them back 21 to 28 days later to get that same vaccine. There will be several vaccines that are available. The storage of the vaccine would have to be at minus 80 degrees. There's a question about how many refrigeration units are even capable of doing that. There's going to be trust issues about the vaccination. And there's going to be conspiracy theories, and there are going to be rumors. And there's not a lot of trust, let's be honest, in the federal health organizations right now. And before people let you put a needle in their arm and inject something, there are going to be serious questions. And then people are going to want to know, well, there are several vaccines available. Is one better than the other? Should I wait for the next one? Is this really the best one? In context, what does it mean to do 40 million doses? Testing has been the main operational nightmare for states, government, since COVID started, right? There have been a number of operational nightmares, but the single largest has been testing. We have mobilized the entire state, county governments, city governments, town governments, hospitals, pharmacies. We do more testing than anyone else in the country. How many tests have we done from the time COVID started? With all of it, we've done 12.9 million tests. 12.9 million tests. Great. More than any state pro rata. 40 million vaccines. A test for COVID is the nasal swab, bloop, and it goes to the laboratory, and the laboratory tells you the results. A vaccine is more intrusive. Roll up your sleeve, I'm going to give you a needle. Everything we've done, 7 months it took us to do 12 million tests. How long is it going to take to do 40 million vaccinations or 20 million vaccinations, right? So it gives you a scale of how daunting this task is. The National Governors Association sent a letter to the President of the United States. I am the chairman this year of the National Governors Association. Last year I was the vice chairman. We asked to meet with the President to discuss how this is supposed to work between the federal government and the states. Today, the NGA is releasing a letter, which is a compilation of questions from governors all across the country. Democratic governors, Republican governors, 36 questions from the governors sent to the White House. Basically, how does this work? We understand the concept, but how does it work? Some of the questions: how will the vaccine be allocated to states? What formula is used? In other words, are you going to allocate it by infection rate? Are you going to allocate it by number of cases of COVID? Are you going to allocate it by population? Who determines how many each state gets? What's the basis that you're using? Is there a national strategy on the prioritization? In other words, is the federal government going to say, I think nursing homes should get it first. I think nurses should get it first. I think doctors should get it first. I think anybody over 70 should get it first. Is the federal government going to do that prioritization? Can they tell us if they're going to condition the release of vaccines, right? The vaccines are controlled by the federal government. Are they going to turn around and say, well, we won't give you the vaccines, New York State, California, unless you do X, Y, Z, right? And can we know that now? Is there multi-state coordination? On our own during COVID, we coordinated with the northeastern states, New Jersey, Connecticut, et cetera. Is there a multi-state coordination piece here, or is everybody on their own? Am I responsible for all of New York and there's no connection to New Jersey, there's no connection to Connecticut, there's no connection to Pennsylvania? And who is going to pay to do this? New York State is already $50 billion in debt between state and local governments. And they have not passed legislation on the state and local relief. If the state has a deficit and the local governments have a deficit, we can't fund essential workers. That's who gets cut when you cut state and local governments. And now you're going to want us to undertake this vaccination program, which frankly requires more essential workers, not less.